Hello, everyone, and welcome to Arthritis Talks, Managing Arthritis with Physical Activity and Assistive Devices. I'm Dr. Sean Bevan, Chief Science Officer at the Arthritis Society, and thank you for joining us today. There are many strategies that people living with arthritis can do to help manage their disease. Some of the things that we at the Arthritis Society are most frequently asked about are related to physical activity and assistive devices. Getting moving is so important to managing your arthritis and your overall health. But physical activity for someone living with arthritis may look a little different than it does to someone who isn't affected by arthritis. That's why we're here today, to discuss what physical activity means for people living with arthritis and to provide you with tools and strategies to enable you to safely get your body moving. Today, we're very happy to be joined by Professor of Physical Therapy, Dr. Linda Lee from the University of British Columbia, and one of the Arthritis Society's occupational therapists, Ava Rudachyk from Ontario. Our presenters will answer some of your most frequently asked questions. Thank you to many of you who emailed your questions in advance, as they really did help us shape today's presentation. So before we get underway, just a few logistics. The webcast is best viewed on a laptop or desktop computer. If you have technical issues, please email support@webcastcanada.ca for assistance. If you have a question for one of our presenters, you can submit it through the Ask a Question section at the top right of the screen. We will try to get to as many questions as we possibly can during the hour that we have together. You can click on the chat window on the right of the screen to connect with other participants and the Arthritis Society's chat moderator. If you'd like to close that chat completely, just click on the icon on the bottom right of your live screen window to view the webinar full screen. We are now using open captioning during our sessions to accommodate the needs of our diverse audiences, so you will also see that running along the bottom of this page. I want to take a moment to thank our event partners for their financial support of this event, including Pfizer, Novartis, United Way Winnipeg, and many others. We have a lot of information to cover today, so let's get started. So first, Dr. Lee, thank you so much for joining us today. Let's get started by answering some of the questions that we received about physical activity. How much physical activity is good for people living with arthritis? What should people be doing? And in particular, what should people with arthritis be doing if maybe they haven't exercised in some time? Over to you, Dr. Lee.
Thank you, Sean. Okay, let's get to the next slide here. So very great questions, and hello everyone online. Well, when we talk about physical activity, we're really talking about anything that require our body movement. So anything that requires to spend energy, which covers everything that we do in the day. Anything that's recreational. So, when we're, walking or, before COVID, when we're able to do a lot more of the fun things like, golfing, skating, skiing, all of those things are physical activity. It also covers things that we do when we're at work, as well as daily activity like, chores, cleaning your home, gardening, those are physical activity. And of course, anything that we are doing specifically prescribed by your doctor, by a physiotherapist to strengthen your muscle and keep your joints nice and healthy, those are also physical activities. So it really covers a lot of things that we're doing. So now you may wonder, how does being physically active help your arthritis? Well, one of the best way to think about it is that when we're exercising, we're really feeding our joint. So when we're moving around, it helps to improve the circulation. So in other words, it bringing nutrients to the joint, which is wonderful because it helps to strengthen your cartilage. It helps to strengthen the soft tissues around it. So your ligaments, your tendons get stronger. And of course, being physically active is good for bone health, for people worried about osteoporosis, for example, as we started get a bit older. And being active, of course, it helps to keep your muscle strong, which also helps to protect your joint. Now, some of you may or may not know that when we're being physically active, one of the advantage is that it actually brings some anti-inflammatory properties. So that is particularly important for people living with arthritis. And in many sense, that's why it helps to lessen your symptoms with arthritis, and also it helps to control the disease activity. Now, we also know that being physically active is good for so many things in our lives, and it helps to manage other chronic diseases such as heart conditions. It helps to improve our moods, and overall, it helps to improve our general health. So you may wonder, what do I need to do to stay active? Now, there are some guidelines out there, and actually there are a couple of new recommendations that came out during COVID-19. So for example, World Health Organization came up with the new guidelines on physical activity, and the good news is that everything you do counts. Every move counts, which is great news. The WHO specifically pointed out that being physically active is good for our hearts, it's good for our bodies, including our joints, and it also helps us stay sharp in our mind. And basically any physical activity is good, more the better. But what is also important in the WHO recommendation is that we need to keep our muscles strong. So muscle strengthening is particularly important to keep our body strong, and for joint health, and also for cognitive health as well. Now, for people who are over the age of 65, adding some training to maintain your good balance is also important, because it helps to prevent falls, which is one of the more problem as we start to get older. And the bottom line is that sitting too much, not a good thing. So that's sort of concrete recommendation. Now, the Canadian, we actually take that one step further. So in October 2020, the Canadian 24-hour movement guideline was released. This is actually very specific, very, very special guideline, because not only it gives the a recommendation around what is a good thing to do, but it also encourages us to think about physical activity within the 24-hour day we're living. So specifically, we're talking about, it's a good thing to maintain 150 minutes per week of moderate level physical activity, which we hear a lot around staying active. But it also reminds us that keeping some of the light activities that we do in a day, several hours a day, a good thing. So these are things that we do in a standing position or walking slow. Those all count as physical activity. It's a good thing. Now, this is the first guideline. The Canadian guideline is the first one that actually encouraged us to think about how do we incorporate sleep as a part of good health and for our everyday life. So approximately 7 to 8 hours of sleep, good quality sleep per day, is a good thing. Now, and I think this is particularly important for people with arthritis to look at the sleep quality. Now, sitting down, resting is still important thing to maintain in our 24-hour day. So the recommendation in the Canadian guideline is that about 8 hours of sitting still, sedentary time, it's okay. So having sufficient time to actually rest our joints is also an important thing to consider during our day. But in a 24-hour day, if you want to stay healthy, limit your screen time, recreational screen time. Less than 3 hours per day is what's being recommended. So it's very specific, and this new information is really helpful for us to think about how do we plan our day. Now, I think one thing that we also want to consider is that people live our day very differently. So this is one of the studies that we recently published that look at people with arthritis. So we had 172 people who wanted to join a program to help to improve their physical activity. And what we asked them to do is to wear a monitor for 7 days. which records everything they do in the day. So we know when they're sleeping, when they're walking, when they're doing something that is a higher level physical activity. We were able to capture that information. Now, we would have thought that this is probably a pretty similar homogeneous group, similar they're doing similar things in the day because they are coming to be trying to learn a little bit more to be more physically active. But when we look at their 24-hour activity, what we actually found was that there were 4 different profiles that people are living in a day. So on your left top, that's the group of people that actually live a pretty balanced lifestyle. They're still sitting a little bit too much, about 9 hours a day. So there's room for improvement. At the bottom left, these are the high sitters. So they sit approximately 13 hours a day. So there's a lot of work that can be done to help to reduce some of the sitting. But what's interesting is that when you look at the right side of the diagram, these are the people who don't do a lot of physical activity, who also, quite sedentary. But a lot of the time, it's actually on top of the screen is switched to sleeping. And at the bottom, these are the people who actually didn't sleep enough. And so if you look at the number of hours that they spend in sitting, it actually increased to about close to the high sitter. So the people who don't sleep enough actually accumulated a lot of time during the day when they're awake in a seated position. What this suggests is that when we're thinking about how to improve physical activity, especially when managing arthritis, there is no one size fits all. And being specific, thinking through how to be active is one way to help us to be successful, to be more physically active. So one of the things that when we work with people with arthritis is sort of do a little bit of detective work and see what are the major issues that that's preventing people to be physically active. So here is one model that is quite useful that I want to share with all of you. So this is called COM-B. The B stands for behavior, so something that you like to do. Now, oftentimes we think that people are not maybe not as physically active. It may be because they don't want to. So it may be the motivation. They may not be as motivated to be active. But from this model, we also recognize that sometimes when people are not active, it could be because they didn't know how to do it. They didn't know what to do. They don't know if what they're doing is going to hurt their joint. So learning more about things that you can do to be active is important. And I know Ava is going to talk a little bit more about that in a moment. The other thing is having the opportunity to be active. And I think I don't need to say anything more. During COVID, the opportunity to be active is quite a bit more limited. So other than thinking about the motivation, we also need to consider whether there are ways for people to do it, whether people know how to do it. Those are very important things. And I think that sort of leads to the point that when we are especially managing arthritis and trying to be more physically active, one of the things is that we need to start small and build it up. So having a goal is great, but having a plan is even more important. Goals are something that lofty, it's January, New Year resolutions. I don't know about you, but we all have a lot of goals, but oftentimes goals cannot be achieved if we don't have a plan to do that. So what I would say, for people with arthritis, if you have not been physically active and trying to start a New Year resolution to be more active, develop a plan. Think about what you want to do, where you would like to do it, when you would like to do it, how often, is it feasible for you to do it? And one most important thing is that set a time for you to check back. The checking back is really important for for you to be able to reflect on what you have done, what you were able to achieve, celebrate the successes, and if the plan sometimes may be a little bit too ambitious, or you may not be able to do everything, be kind to yourself. It's okay to dial back, especially during COVID. But this whole process of setting a goal, developing a plan, and checking back is, sort of the ingredient for success when we're trying to be physically active.
That's great, Linda. Thank you. That was a lot of good advice and valuable information. And I think, as you say, a great segue to Ava. So let's turn it over to you. Many of the questions that we received were from people that were actually worried about increasing their pain as a result of physical activity and doing more damage to their joints. So what can people do to reduce their risk of injury? And of course, people don't want to worsen their symptoms.
Hello, everyone. Thank you for having me today. So before I answer the question, I just wanted to give a quick thank you to all of the AREP therapists who I work with who have over many years have spent a lot of time with the following content, creating the following slides, looking into the research behind a lot of the slides and images today. So thank you to them. It would make a lot more work for me if it weren't for their help over many years. So to answer the question, how can people with arthritis reduce their risk of injury? So Linda has spoken to physical exercise and has also alluded to the point that, of course, exercise plays a huge role in injury prevention. So don't forget about that as I move forward with the following slides. But something that's less talked about is joint protection strategies. And they can go a long way in injury prevention and in also reducing pain flare-ups in arthritis. So a summary of our research shows that joint protection has been found to be a relatively cost-effective way to decrease short-term pain and assist with overall patient perceived independence and quality of life, especially when it's combined with exercise and with other treatment strategies such as modalities or splinting. So in the 3 different systematic reviews that I've looked at, as well as many OA and RA guidelines that exist, they all include joint protection strategies as part of their best practice for treatment with arthritis. So you might be asking at this point, what exactly is joint protection? It's a self-management approach that aims to improve functional ability or maintain it by adapting the method and movement patterns of affected joints. So in short, joint protection strategies go a long way to reduce the force in your already damaged or painful joints. They help to lessen the risk of damage in the future, make activities safer and easier to do. They may even help with swelling, and they may also increase your energy. So unfortunately, there's no one joint protection strategy out there, nor one device that is suitable for all individuals with arthritis. Some may be more appropriate to try first over others according to research and according to the condition you have, the type of arthritis you have, but we cannot successfully implement the use of these strategies without any self-reflection. So as Linda was saying, we have to be a detective in our self-care. So one way to help be that detective is to kind of think of our pain or condition. I like to use a traffic light to help us identify maybe some areas or what level of pain we're having in our disease on a given day. So if we're in the red zone, we have many, many active joints. We have swollen joints, maybe damaged joints that are very painful. We may be in a pain flare with lots of fatigue. So usually, if you guys remember when you've had your very first flare-up, if you have an inflammatory disease, for example, you'll probably really remember how bad it was when you were first diagnosed or first feeling those symptoms. That would probably be the red zone. The yellow zone would be more of a medium pain day. So most people with arthritis, they end up living with some degree of pain. And so most of the time they may fall under this yellow section. And they may have medium fatigue or even maybe some mental stress going along as we're, for example, dealing with COVID. Most of us are having some level of stress. And then in the green zone, this may be fewer days than in the yellow stage, but in the green phase, We are not in a flare-up. We may have medium to high energy, maybe low to medium pain. Sorry, I'm just going to go back a second. And we may still have some damaged joints or pain, just lower levels of pain and higher energy. So we first need to identify what stage we are in that disease. Then, depending on where you are in the light, you might change which joint protection principle you use on a given day, or even an exercise that you might choose to use on a given day. So often when people are in the red zone, they are so overwhelmed with pain, they already are intuitively engaging in joint protection strategies. Many only engage in joint protection strategies as a last resort. So when they feel lots of pain, that's when they instinctively choose a joint protection strategy. So for example, you might start to use two hands because your dominant hand is very swollen, very painful. And so then you're forced to use your both hands or the other hand as a compensation. However, once that pain flare-up maybe goes away or the pain subsides and you enter back into the yellow or green stage, you might return back to your old habits and thus re-aggravate your pain later on and enter back into the red zone, and hence this vicious cycle of pain continues. So engaging in joint protection, not just when we're in the red zone, but when we're in the green and yellow zone as well, will help to reduce the times you enter back into the red zone and thus stabilize that roller coaster pain ride so many individuals with arthritis are on. So in short, we really need to start to listen to our body and respect our pain. As I mentioned before, most of us are living with some level of pain in our day-to-day life. However, it's important to distinguish what is usual and what is not usual. What type of pain are we having? Is this swelling pain? Is this muscle pain? Is this joint pain? And is this a pain from a damaged joint, or is this more a swollen active joint that's giving me pain? In a general rule of thumb, if activity that you're doing, if any one activity, whether it's a physical activity or something you're doing in your daily life, like kitchen work, any activity resulting in joint pain that is more than your usual and takes more than 2 hours to settle back down to your usual should be modified. This doesn't mean that you have to stop totally engaging in meaningful activity. For example, if you engage in crochet, but this aggravates your pain, maybe you might consider first trying how long you engage in that activity for. Maybe you'll try a splint. Maybe you'll change the width of your crochet needles. And then, as Linda said, we always need to reevaluate after we've implemented this over some time and see if the strategy actually worked. So you might decide to, for example, use a pain scale to help identify that. Okay. So just to help kind of organize what joint protection is, I've broken it down into 3 different sections. The most promising evidence in preventing injury is to look at posture and alignment first. This is our core principle. So poor posture while engaging in activity puts one at risk for further damage or injury, both to the cartilage, to the joint, and the surrounding ligaments. Most people with arthritis, however, also have difficulty with postural control, making it thus all the more important to practice good posture. Using good posture distributes the work over our muscles, helping to conserve our energy better and reduce the abnormal forces on our joints. So first, start attending to your posture more often. For example, you might set a goal of attending to your posture at mealtime or maybe when you're using the computer. Try to use good body mechanics, whether you're standing, whether you're sitting, or whether you're lying, as we see in these images, and make the tasks easier and safer to engage in. So in short, a good posture is integral when using any device, when doing any activity, and especially when doing exercise. So for example, since we're all sitting here today, I'm assuming, watching today's presentation, if you're using, for example, a laptop, you may prop your laptop up at eye level using a couple of books. Maybe you'll have an external keyboard, which you can place a bit lower to maintain a neutral alignment of the wrist and hand. You might use a lumbar cushion on your chair to help offload that lower back and reduce some of the back pain you might be experiencing. Or you might use a footstool to keep the knee and hip alignment a bit better and offload those knee and hip. And since Linda's also talked about sleeping, I'm going to just mention that it's also important to think of your posture when we're sleeping too. So try to maintain it in a neutral position and try to fill your cervical space of your neck. Side lying is the position that facilitates the best alignment. So often people will put a pillow, for example, between their knees when they're sleeping to help stabilize their hips and keep the spine straight. So as you can see from this image here, simply holding your phone or tablet at eye level can go a long way in reducing neck pain and strain. Only 15 degrees of forward flexion at your neck already substantially increases the strain to the neck, not to mention changes the entire postural compensation of your shoulders and upper body. You can also think that if the hands are holding a device, you may consider headsets to help with maintaining good posture, or you may place your device down using some sort of stand, pop socket, something like that, to help reduce the strain through your hands. So the next section is looking at changing the method of how we engage in activities. So really, when we're looking at changing how we approach a painful activity, one of the simplest things in theory to do is to plan, pace, and prioritize your activities, or even delegate some of the ones that are painful to maybe a family member or community member to do. This will help to balance your work with rest. As Linda was saying, we need to make sure that our exercise is balanced. Same thing when we're approaching activities that are difficult for us to do. We may decide to alternate heavier movements with lighter activity, and this will give our muscles a break. So for example, we may organize household chores on a calendar and spread them over the week or the month rather than leaving it all to one day. We may have a family member, a community member, for example, help us out. So again, following, of course, COVID guidelines, but say we're at a cashier and we know that we have difficulty opening a jar, and maybe asking the cashier to loosen the jar before you take it home. You may also decide to plan your groceries to take fewer trips, for example. A second principle in changing the method is to avoid staying in one position too long. So I know Linda's already talked about this, and as she mentioned, really tension can build around the joints quite easily, and muscles can tire when we're holding it in a static position for too long. So that's why exercise is so important, but we can also think of this when we're engaging in activities that bother us. So maybe it's sitting, doing computer work, watching TV. For sitting too long, joint stiffness can also increase. So pay attention to your body's signal and change your position every about 20 to 30 minutes. Think of places or times when you can sit instead of stand, or alternate between sitting and standing better. So for example, if you find it painful to stand in the kitchen and do kitchen work, is there components of that task that you can take to a kitchen seat and sit and do that for? Maybe it's holding something. Maybe you're holding a device for too long or a book, and that's aggravating your pain. I like to use the analogy of a bald spot developing on a tire. So if the car is sitting outside for a long period of time, eventually a bald spot will develop because of the pressure points that are happening. So we can think of this the same way when we're sitting for too long. For sitting, the same weight is being distributed through our joints, and that bald spot, in a sense, not really quite the same, but the same pressure points are happening in those already painful joints. So that just kind of is a great analogy to describe why we need to get up and moving. And there are devices that can help us do that. So things like sit-to-stand desks have become very popular in recent years. Perching stools for the kitchen, bath chair in the shower. Sometimes people will find it too hard to stand in the shower, or like I've mentioned before, holders for books or other devices. Another part of changing a method is using larger or more joints to complete a task. So if you think about it, larger and stronger joints can take more of the load than smaller joints. A great example of this is getting up from a seated position. If we're using our arms and our shoulders and our hands to push ourselves up, of course, we may be prone to more injury in our shoulder and our rotator cuff muscles. If we raise our chair up a little bit, whether that's through a cushion or just simply raising, for example, an office chair, then that offloads some of the pressure through our joints, and we can, rather than using our arms and hands, use the bigger muscles around our hips and our knees. This will be they're more prone, it's better for you to take that force. They're better for you to take that force, excuse me. So again, another point to this could be using two hands. This again distributes the force and lessens the stress on one hand. And again, trying to avoid prolonged or intense gripping. We also want to try to avoid heavy lifting. So if possible, especially if you have a swollen joint or you have osteoporosis alongside your arthritis, you want to try and avoid heavy lifting. So wheels or sliding objects can help with this. Always think that pushing an object is always easier than pulling. So if you think of that garbage can that you have to roll out to the curb, when we push it, we're maintaining that first principle we've talked about maintaining good alignment. And we're pushing and using bigger joints in better alignment rather than pulling something and dragging it behind us. And the very last section, I'm just going to talk about specific devices and categories that we can think of when we're choosing devices for arthritis. So again, we talked about how falls can be a big problem with people with arthritis, especially as we age. So we want to stay safe. And again, we can do this by raising, for example, our toilet seat with a device. We can use grab bars to help grab onto, maybe a non-slip mat in the shower so that we're not slipping, but make sure that we are safe when we're doing transfers. So getting in and out of the shower, for example. Okay. And then just to kind of break down into 4 other categories, so we want to always support good alignment. We can do so by using devices like angled knives to lessen the stress on the wrist, or we could use a brace. Long handles will always make things a bit easier. It will reduce the force you need to do a job. So for example, a jar key or a shoehorn or a dressing aid can help to make those tasks easier with less force. Large or non-slip grips make items easier to hold so you're not having to squeeze. So foam tubing, for example, can be placed over a device, or just using a commercial non-slip grip on devices can also help. And then, of course, a battery-operated or electrical device is makes it easiest for us to perform a task. However, if we're storing that device in a place where we have to bend over and it's inconvenient, we may not use that device very easily. So think about how we're storing it too. So lastly, choose well. Again, a lot of people I have seen in my practice buy lots of devices that they never use. So that being that detective, thinking about what pain we're having on a given day, we might reach for a different object, but think about the activities that are creating pain for you and making your pain feel worse. Start there and then think of these principles to choose a device that works for you.
Great. Thank you so much, Ava. You covered a lot of information there, and I think our audience certainly related to a lot of it. I know one audience member asked, how did you know that they were slouching? And I know some are worried about having more days in the red zone than otherwise. So maybe we'll come back to some of that in the Q&A. For now, let's go back to Linda if we can, and switch gears a little bit. We hear more and more about activity trackers and activity tracking devices coming into the market, and I think more and more people are using them. So do these kinds of devices, do they actually have the ability to help people manage their arthritis?
Yeah, thanks, Sean, for the question, and thanks, Eva, for some of the very interesting tips that you've shared. So to promote an active lifestyle, there's certainly a number of wearable devices are available in the market, sort of to help people to track their physical activity and give feedback. So if you look at the research that's being done to date, it does suggest that using these type of device give a little bit of assistance for people to be a bit more active. And, in many sense, it makes sense because when you look at the use of these devices, it uses a lot of very powerful behavior change sort of techniques. So, for example, it helps you to self-monitor. You can set goals and you get feedback when you're doing something. And the beauty of these devices is that it tracks your activity. So you don't have to count. It counts for you. Now, whether it's accurate or not, we'll come back to talk about that in a moment. But some of these devices also allow you to invite friends and families to form a group, and so you can have your social support and celebrate successes together when you're able to meet a goal. So it's certainly very useful to help motivate people to be active. If you remember, I just showed the COM-B model. Motivation is one of very important thing to help to increase physical activity, but there is some drawback. For example, when you use these devices, there are certain things that a device by itself cannot do. It helps you, or it helps to empower you to set goals, but you still have to develop a plan. The device by itself is not going to be able to plan where you're going to walk, for example. When there's problems comes in the way, when there's barriers coming in the way to be physically active, the device is not going to help you to solve that problem. And most of the devices is not going to help you to practice your behavior to be physically active. So that's part of the reasons why these devices sort of help, but it helps a little bit, but it's not the complete package that we that we would like to see. Now, one thing I do want to point out is that a lot of devices are in the market, and the different models and the cost, the pricing is also different. And I think the important thing to pay attention to is sort of how accurate they are in terms of measuring your physical activity. So a few years ago, a group of us did a review of all the studies out there that look at how accurate Fitbit was as a device. So the diagram that you're looking at in front of you, it shows the number of studies that are looking at how accurate Fitbit is to capture different types of activities, and you can see the different types of activities at the bottom of the diagram. And what it really tells us is that in the 67 studies that we look at up until 2018, if you are using your Fitbit to do sort of walking type of activity or jogging type of activities at a fairly normal speed, Fitbit's great to capture your steps, your activity, and the error for measuring those type of activities, it's somewhere around 10%, underestimating the number of steps. But if you are a slow walker, very, very slow walker, so imagine someone with a lot of pain in their knees or their hips, walking very slowly. Or if you're wearing these devices to do your everyday chore, daily activities, you may find that your Fitbit may not be as accurate as you would like, because these type of devices are not very good at capturing very slow walking activities. And as you can see at the bottom in the diagram, some of the studies, each dot is representing one study we look at. Some of the studies suggest that Fitbit is not capturing like almost all the steps that the person was walking when they're walking very slowly. And when we're walking, during our daily activities, when you're doing stop and go, that's when Fitbit is not very good at capturing accurately how many steps that you're walking. So I think when you're looking at the step count, when you're using those type of devices, have to remember that it has its limitation. It's not the the most accurate things as compared to some of the research-based type of monitors that we use in the research setting. Now, one thing that I also want to mention is that where you wear the device matters, depending on what you do. So the studies that look at how accurate Fitbits are, if you're jogging, wear it on the wrist. It's pretty good in capturing your steps. If you're walking at a normal speed, it's actually more accurate if you clip it on your belt or wear it in the hip area. And if someone who's walking very, very slowly, again, thinking about someone with very painful knees, it's better off to wear the device around your ankle. It captures your steps a lot more accurately as compared to wearing it around your wrist or around your hip. So something to think about if you're using these devices. So based on some of the information around, how good these devices are, what are the limitations for when we use those devices, we develop a program to help counsel people to be more physically active. We did use Fitbit as the device. And in this program, we have a group education session. And the key of that session is to help people to develop some skills on how to set goals and plans and set their goals, develop a plan, and how to go about achieving a realistic physical activity plan. We partner them with a physiotherapist so that they can get some counseling either by phone or by Zoom. We used to do in person. There's no more in person during COVID. And we actually find that doing Zoom counseling in many ways is actually working out very, very well. And we're very grateful for the Arthritis Society and also funding from the Canadian Institute of Health Research that help us to develop a mobile app that helped us to do two things. One is to visualize the information that's captured by your Fitbit in a way that makes more sense for people with arthritis. So it basically break it down in terms of the number of steps, the level of activities that they do during the day in a way that it makes more sense for everyday users. And the other thing is that we allow people to track their symptoms. So on the right-hand side of the slide, you can see that this is the dashboard of the app. We call that Operas. And you can see that this individual is tracking their pain, their fatigue level, and the disease activity. And they can look at, sort of the ups and downs of their symptoms and disease activities alongside at the bottom, which are number of steps that they walk. So over time, people who track their symptoms actually get a lot more information to inform them around, whether they're doing too much or doing just enough when they're being physically active. And that is a really powerful way when we're talking about, sometimes you have to try out some activity and see if it's good for you. If you track your symptoms, it actually gives you the object or the information along with the objective measure of your steps in your physical activity, so that you can understand how the activity is affecting your arthritis so much better. So perhaps I will address, Sean, your question by giving a concrete example, and this is Eileen. Eileen is a special, amazing person. She has rheumatoid arthritis. She's also an artist and a mother. So that's a lot going on with Eileen. We first met Eileen as a patient partner for research, and she subsequently also participated in some of our projects. And she can tell you a million things, how physical activity or being physically active has changed her life. And most importantly, she's now able to do some strength training without hurting her joints or causing symptoms in her joints. So that's a big bonus. But Eileen also writes a blog about her how tracking her symptoms and physical activity has helped her. So a few weeks ago, I was teaching physiotherapy students at UBC, and I actually invited Eileen to talk about her experience. And so I have permission from Eileen to use these slides to share with you. And what you're seeing is, sort of how Eileen used Operas to, track her pain, her mood, and her number of steps, and the things that really helped her to manage her health is really around understanding a lot more about when her medication start to work and when it start to wear off, and what and how much it is related to the physical activities that she did during the day. overall, it really helps her to understand how to have a deeper understanding about her health, and also help her to better um, plan around her chronic illness and her daily life. So it's a really powerful thing that, once you are able to understand a bit more about the fluctuation of the symptoms and what you do in the day. And so I think, using technology, it helps to, give a lot of opportunities for us to learn about ourselves and help us to manage arthritis so much better.
Thank you, Linda. It's so interesting to hear about all your research on these devices that some of us know so well. Maybe Ava, I'll turn it back to you. Could you address what assistive devices, what types are available for people living with arthritis?
For sure. Yeah, thank you, Linda. That was really helpful. I think when we go back and we reflect on even the activities we're choosing to engage in, using a device and app would be wonderful. So I tried to think of, when I'm answering this question, what devices might make exercise easier. I tried to think in today's world, with most of us having to either stay home or get creative in our own environment, how to continue to exercise a bit easier. So with the many pool closures and gym closures, it has been difficult for people with arthritis. So a couple of devices that might make things a bit easier are, for example, for yoga enthusiasts, there are things like yoga jellies out there, which can be used to offload a painful area and cushion it when we're doing positions in yoga. Going back to thinking of joint protection strategies, you don't necessarily need yoga jellies. You could even, for example, use a cushion off of a chair, or roll up the mat, or change the position so you're not loading that joint so harshly. A lot of patients I talk to also have pain when holding dumbbells. And so wrist weights have been something that they've used an alternative, so you can still continue to engage in those weight workouts that are so important, but use something that doesn't aggravate your pain. TheraBands are a cheap option to dumbbells that are usually easily available and storable in a small space. And then, of course, things like splints can be used. Now, this is something I suggest you talk to a therapist about, which ones are more appropriate for the activities you're doing, to make sure it makes sense for what you're using it for. But they can go a long way in either cushioning or realigning the joint while you're engaging in activity. And then, of course, we want to also offload our painful joints in our lower body. So walking aids can also encourage us to both walk inside or outside. If you're walking with a bit of a limp, for example, this may help to release some of the stress on that side of your body that is limping, and may help reduce some of the muscle weakness by balancing the muscles better, and can also reduce the pain. Walking poles have become really popular in recent years. There's Nordic poles, there's urban poles. Urban poles tend to have better grips, more ergonomic grips for those who have arthritic problems in their hands, and different tips on the bottom to engage in movement. And the movement patterns are a bit different. So I would suggest, if you're not familiar with the difference between them, on our arthritis.ca website, or even on YouTube, if you search Arthritis Society and then you look up pole walking or walking, they give some tips on using urban poles. So that can go a long way also to encourage good posture. And then if you find you're too unstable on either of these, with either a cane or urban poles, a walker might be the right choice for you. And then, of course, it seems like such a basic suggestion, but footwear goes a long way. Now that we're spending more time inside, often people are walking barefoot inside the home. But a good footwear that supports the alignment of your foot, it can work its way all the way up your body. So helps with supporting not only those tender and painful joints in your feet, but also through your knee and your hips, and all the way up to your lower back. So always think that you should have supportive footwear both inside and outside when you're engaging in activity, and that will help to reduce your pain. And there's also, again, online on arthritis.ca website, on the resources, there is a footwear advice, and there's also a quick video for when you choose walking. It talks a bit about footwear as well.
Great. Thank you, Ava. Thank you both, actually, for all this incredible information. We're going to save some time for some of the live questions from today in a moment. Before I do that, do either of you have any final thoughts or recommendations for our audience? Linda, maybe I'll start with you.
Yeah, I think my main message really is that moving is better than not moving. Strengthening does not replace, or walking does not replace strengthening. I think strong muscle is absolutely important to support the joint. And the last thing is that, some of these devices that are out there are really useful to help, monitor our activity and giving us feedback, but knowing the limitation and working with a health professional who understand those devices and guide you through how to interpret the information, or perhaps to set a realistic plan to be active. That is the recipe for success.
That's great, Linda. What about you, Ava?
I would just add to that also thinking about giving yourself that feedback on a daily basis of where am I at with my pain today or this week, reanalyzing it. So those devices that Linda talked about can really help to give us more concrete evidence, but making sure you spend that time before implementing any strategy, whether it's an exercise, whether it's a device, to think about what was my pain before, what was aggravating me before, and is this helping after, a couple of weeks of trying it?
Thank you. So I'm going to turn to some of the questions that we just received. First, Linda, I will turn to you. You piqued many people's interest when you were speaking about your research in particular. So I'll ask a couple of questions around that. The first is really, clearly we have some people using Apple devices, and do we know anything about how accurate the Apple Health app is, et cetera, as you've done the work around Fitbits? And similarly, is the Operas app available to people to use?
Right. So thank you for the questions. I'm not as familiar with the Apple Health device, how accurate it is in terms of measuring your physical activity and your walking. But I would imagine that the accuracy really around two things: where you carry your phone, and I think. So I'm talking about the using a phone app to measure your steps first. So where you carry your phone matters, because a lot of these devices, including Fitbit, Apple, other types of wearable devices, they're first and foremost they're accelerometers. So what it means is that it measures your movement when you are when you're in the space, moving forward, backward, side to side, and moving up and down. Okay, and the device, or the company will have an algorithm to decide when you're moving in space in a certain way, is that a step or not? And if it is, then they'll count it. So that's why where you carry your phone or where you wear the device matters depending on your activity. And I would suspect that. This is from the expert in my household. My father would tell me that the Apple phone is not good, and because my father does not carry his phone everywhere. So I think that also counts to how good it is, in terms of measuring your daily steps and your daily activities, using those devices. Opera's app, yes, it is available for everybody to use. So we are running a randomized control trial right now. So before COVID, we would not allow people to access that. But during COVID, we actually heard a lot of from people with rheumatoid arthritis who really want to have a way to track and monitor their symptoms. So we have received ethics from the university, and we actually can give permission for people to download the app and use that. So, Sean, I'm wondering what would be the best way to actually, for people who are interested in, perhaps to contact us, or maybe they can contact the Arthritis Society and you can pass on the information, and then we can, give people access to the app. Would that work?
Absolutely, that's great. Thank you, Linda. And is there a cost related to that for people?
No. Absolutely not.
Excellent. Ava, what about for people with arthritis in their shoulders? Do you have any recommendations about how they can do things where they have to put their arms over their heads, like putting on clothes, or even also buttoning up shirts, things like that?
Mm-hmm. So one handy device would be a dressing stick, and it's a long stick with two little hooks on it that can make it easier to take shirts on and off. But something as simple as just choosing maybe looser or baggier clothing that don't have lots of buttons or zippers on it to fidget with may be also an alternative. But if you do like to have buttons on your shirts, there are things like button hooks, which can make it easier to do up those buttons. And also just changing, like for a lot of people, winter jackets are a problem putting on if you have shoulder problems. So often what I do as a strategy is put the shirt with the whole armholes facing you on the back of a chair. And then that can be almost like someone holding a jacket up for you. And then you can sometimes slip in your arms that way a little bit easier and then pop up without having to lift your arms up. So that's a method, not so much a device, but there's multiple things you can try. And depending on how severe it is or how much movement restriction you have, a therapist can help kind of sit down with you and figure out what works best for you.
Great. We've also had a few questions about physical activity and also strengthening your joints. So we heard, I think, from Ava about, be careful about heavy lifting, but the counter to that we hear about here is about, doesn't weight training actually improve your muscle tone, et cetera, therefore improve your arthritis? So I wonder maybe if both of you could clarify that a little bit. How do people differentiate between what's good for them and what may not be good for them?
I can start. So I would say it really depends on the person and how much pain they're having. So like I said, kind of at the beginning of the slides on joint protection, is the only activities that need to change are really the ones that are increasing your pain, your kind of typical pain. If it's making it worse, then that might be when we need to back off a bit. But yes, strengthening is integral, and I'll let Linda pick up on that. And it is important to engage in it. And we can do it even without necessarily weights in our hands. There's lots of ways you can strengthen without weights. So I do agree you need to find a way to strengthen. It's just a matter of figuring out what works for you and your body.
I agree, and even when you talk about the 2-hour rule, that's very important. Knowing what is the good pain and what is the bad pain when we're doing strengthening, so that we can confidently, engage in those type of activities. So one thing that I think when we talk about strengthening, oftentimes people think about, using machines, lifting weights, lifting heavy weight. And it's oftentimes it's not just that, so for example, when we're talking about people with knee osteoarthritis, oftentimes the strengthening type of activities, you want to strengthen the muscle around the knee to protect the joint, but we also want to work with people to strengthen what we call the core muscles, so your abdominal muscles, your hip muscles, so that you actually have a more stable lower body. And having that improving the muscle strength around like the lower body as well as around the knee joint, it helps to unload some of the pressure in the knee, and it's more stable as you're using the joint. So for people who may be just starting, having a health professional to be able to guide you, that would be helpful. In different parts of the country, I understand that for osteoarthritis, for example, the GLAD program is quite helpful in terms of teaching how to do some of these neuromuscular type of exercise, meaning that it helps to work on the muscles to help to stabilize the lower body better. So I understand that during COVID, some of these programs may be, delivered online. So there are opportunities to perhaps access some of those resources and learn how to do strengthening properly without hurting the joint.
Yeah, and just to quickly clarify, when I talk about pain, I'm talking more about your joint pain. I'm not referring to muscle pain. So most of us know that delayed muscle onset soreness is normal after we've engaged in strengthening and is to be expected. And there is some argument too with osteoarthritis. When we're doing strengthening in the larger joints of the hip and knee, we might experience a little bit of discomfort in the joint, maybe 1 or 2 points of pain change. But as long as it goes back down to your typical after you finish that exercise, it's typically safe. Now that's for osteoarthritis. Inflammatory disease is a little bit a different story. So we have to be a little bit more careful, especially if there's swelling in the joint. But it is first and foremost, make sure you're differentiating between the two types. Joint pain, we usually don't want more of that, and muscle pain is to be expected.
Okay. And maybe just one last question, Linda, you really spoke about the importance of sleep. So are there any particular sleep positions that are better for people with arthritis, and or any assistive devices that people might want to know about?
Yeah, so I'll leave the assistive device question to Ava. I think she's more knowledgeable in that area. I think with the sleep, first and foremost, you need to have a comfortable mattress. That is, probably, the support is important, so that you are able to sleep comfortably. I think one of the major issues for people with arthritis trying to get that good quality sleep is that the pain may be waking them up at night. So, and if it is the case, then it may be a good idea to speak with your doctor if you are able to access your doctor quickly, or talk to your local pharmacist just to talk a little bit around when to take the medication before you go to sleep, so that you can just time it and have that good pain control, good quality sleep at night. That would be important. And I think in the broader scheme around having good sleep, there is some practice about good sleep hygiene that Ava probably also want to add more about that. But making sure the room is dark, not having keep your devices all somewhere else, not close by, and don't use it right before you go to sleep. Just having some quiet time before you go to sleep. Those are the sort of things that helps to improve the pain quality, the sleep quality better. So, like in terms of specific position for sleeping, I think it's quite individual. Depending on what is bothering you, in terms of joint pain, and so it is hard to answer that what specific position is sort of good for sleeping. So, but Ava, I'm gonna see if you have any thoughts
Sure.
on that.
Yeah, I would just add that a body pillow, I don't think I mentioned that. I did mention positioning while sleeping a bit. So cervical pillows, or a pillow that you can help when you're sleeping, either if you're on your back, making sure it's in the cervical position of your spine, or when you're side lying, that it's supporting the side of your neck, making sure that it's not too high, that it's kinking your neck one direction or the other will go a long way for back pain, and even all the way down to your lower body. But a body pillow, often people like to hug that to support them, and that will help them from rolling over onto their stomach if you're a stomach sleeper, or a pillow between the leg to help stabilize the hips if you have hip and knee pain while you're sleeping. And I don't know if you mentioned this earlier on, I can't remember, Linda, but I think even Fitbits, they can track the quality of your sleep as well. So that might help to determine if, again, these strategies are working for you.
Yeah, so take it with a grain of salt with the Fitbit tracking for sleeping. So what Fitbit is able to tell in terms of quality is how much you move.
Mm-hmm.
So when you move, it record that particular movement when it detects that you are not in a walking type of activity. So you know that you're lying down when you're not moving for a while, and when you have a movement, they'll take it as you're sleeping and move around, so you can actually see that in the graphical representation, your quality of sleep. But oftentimes people would say that the quality of sleep, it's either over-reporting over-reporting good quality. So people may feel that they're not sleeping too well, but Fitbit says that they're sleeping really well. So I think take it with a grain of salt, just because it is really an accelerometer. So it has its limitation in terms of tracking the quality of sleep.
So thank you so much to both of you. We have run out of time, but thank you, Dr. Lee and Ava, for sharing all of your expertise today. We have had many questions to this effect. The video and presentation slides will be emailed to all of the registered participants this week. And you'll also receive a recording of the webinar, and it will be posted to our website very shortly. I also encourage you to visit our Assistive Devices resource and our Staying Active e-learning module available at arthritis.ca for more information about a lot of what we talked about tonight. We'd like to take a few more moments to get your feedback on today's presentation if we could. So if you are on a laptop or a desktop computer, you will see a poll question come up on your screen with a yes and no answer. So please do tell us what you think. Click on the response that reflects your thoughts. In a moment, did you find the information in today's webinar helpful? We will also be sending an evaluation form out with the recording. So if you weren't able to access the poll or would like to give us some more feedback, please do so. Take the opportunity at the time. Once again, thank you to Pfizer, Novartis, United Way Winnipeg, and our other sponsors for their financial support of this event. We invite you to support us as we work to continue to create valuable resources to help you better manage your arthritis. If you are able, please do consider visiting arthritis.ca/donate. Our next event, Arthritis Talks, Medical Cannabis for those 50 plus, is coming up on Tuesday, February 23rd. To register for that event, please visit arthritis.ca/arthritis talks. This concludes Arthritis Talks, Managing Arthritis with Physical Activity and Assistive Devices. On behalf of all of us, thank you so much for joining us today, and do please stay well.